discuss an interesting tips and tricks for a TOG article in 2021 discussing the enhancement of surgery of endometriosis and why ablation is failed. We all of us know that there is a debate, ablation or excision. We discussed before in issue guidelines. Now we are focusing on this talk article because they are giving our tips and techniques of surgery, and they are summarizing it for the SOSURE framework, which we will know now. Endometriosis excision is better than ablation. Ablation, you are not seeing, there is a deep invisible tissue, you are not seeing it. You are just making a temporary damage of the tissue, so there is a hidden disease. So the core principle of this talk article is restore the anatomy before excision. Restoring the anatomy is the golden key regarding the success of surgery of excision of endometriosis. How we will restore the anatomy? There is a framework, SOSURE framework. It's a surgical mindset. It's not a rigid steps, but we have to start stepwise. Survey and sigmoid mobilization, ovarian mobilization, suspension of the ovaries plus or minus uterus. It depends on the depth of the tissue damage. Ureterolysis, saving integrity of the ureter by saving its adventitia. Rectovaginal, pararectal space. Finally, excision of disease. Surgical anatomy is very important and critical, and there is dangerous zones for the surgical anatomy. The pararectal space, hypogastric nerves, as we know, the importance of hypogastric nerve, and if it is at least you have to save one hypogastric nerve. Bilateral damage of the hypogastric nerve is a disaster for the patient. Rectovaginal space, butterfly area contain uterosacral ligament, torus uterine, pelvic sidewall. About the exam build for the MD or MRCOG, start dissection in normal tissue. Preserve ureteric adventitia because it contains delicate blood supply, can be damaged by thermal energy or by blunt dissection. Suspension often better than uterine manipulator. SOSURE framework is not a rigid steps, it's a surgical mindset. Hoping you find this short video useful. Subscribe in the channel and follow for further tips and tricks for MD and MRCOG.